Our next syndrome is one of the rare craniosynosstoses, Apert syndrome or acrocephalosyndactylism. In Apert syndrome, we find many of the manifestations of the patients that have thalidomide poisoning. That is, that there are deformities of their extremities, like a mittened hand. This brings rather poignantly to us the problem of prescribing medications which may cause defects in the developing uterus. We know that many of the drugs today are producing a variety of anomalies, and it behooves us to be very, very cognizant of any female patient in childbearing age in which we make a prescription available to this patient that we might be causing potentially genetic damage. Approximately 1 in 160,000 cases in which there is a live birth, we may see patients with Apert syndrome. However, because of the high infant mortality that occurs in this syndrome, we only see about 1 case in every 2 million of the population. The majority of cases of this syndrome, acrocephalosyndactylism, are sporadic. However, this doesn't preclude the possibility of new mutations that might occur. We see sometimes partial signs of this syndrome in some patients. Other patients' siblings may exhibit the full-blown manifestations of the syndrome. We see that the patient may have the fusion of the fingers. The syndactylism, as the name of this syndrome implies, we find that in the skull it has an oxycephalic appearance. It's a high, prominent, steep forehead. The occiput region is flat and in the kind of the same vertical plane as the neck. When we look at the hands, this syndactylism, it's kind of a symmetrical defect that varies in degree from partial fusion of the skin to actually a true osseous fusion of the fingers and the toes. When the fingers are completely fused, there's often just a common nail, and the hand may appear like a mitten, somewhat like the thalidomide children. The middle third of the face we see is somewhat flat and underdeveloped in this individual, and there was hypertelorism. The oral manifestations suggest that some problems in the hard and soft palate. We've seen patients with a high arched palate. Some of them have this median furrow of the palate. There can be an underlying cleft palate or a bifid uvula. The teeth are markedly crowded, and there's this thickening of the alveolar process. Posteriorly, we can see at a very young age, even before the teeth may erupt, that there is a characteristic lateral palatine process swellings. This swelling or enclosure of the palate is a little bit like the patients that we saw with maxillary disease and cherubism, or sometimes in cases of fibromatosis gingivae. The cases of acrocephalosyndactylism bear a rather strong resemblance to craniofacial dysostoses or into Crouzon's disease. Studies of a genetic nature, insofar as the chromosome complements, have revealed a normal complement, and there's no evidence of gross chromosomal abnormality. Some investigators have suggested that the advanced male parental age has an effect upon the occurrence of this syndrome.